faced by healthcare professionals and bereavement support at the time of COVID-19 pandemic. Today's webinar is very important because the frontline workers, the doctors, nurses, counselors, and other paramedics are undergoing lot of traumatic experiences. In the hospital, the treatment for other diseases has stopped completely, except emergency cases. Therefore, the healthcare workers are undergoing traumatic experiences. Fear of getting sick and constant exposure, and fear of bringing the disease at home. The amplification of information by social media also is creating lot of panic and anxiety. At this challenging time, CanSupport is still working. CanSupport is a palliative care organization which provides home care to the cancer patients. Even during this lockdown period, despite so many challenges, CanSupport teams realize that the need for palliative care has increased. Therefore, we have experts from different fields of hospitals, CanSupport workers, and psychiatrists who will talk about these issues. I would like to introduce our first speaker, Dr. Bhawna Sirohi. Dr. Bhavna is the Director of Medical Oncology, Max Healthcare, Saket. She will talk about frontline experience in hospitals at the current time. Over to Dr. Bhavna Sirohi. Thank you.
Thank you, Jaspal ji. Good afternoon, everybody. I must congratulate CanSupport for organizing this and understanding the challenges that the healthcare workers are facing in this time. And I must especially congratulate CanSupport teams, who doctors and nurses and psychologists who during these times have actually continued to provide home care by going to patients' homes and providing either end-of-life care, palliative care, or medical care, or even cancer care. So I think I thank you for it, and I am proud to be associated with CanSupport for more than a decade now. I'm going to, for the first few minutes, talk about the challenges that are faced by a doctor on a personal level, and also how I cope with it. I think the C word, the cancer, which we used to identify with, used to strike a chord of fear, despite us having amazing results and amazing progresses that have been made over the last decade. Cancer is easily curable and treatable. We know that, but it still strikes a chord of fear. And Corona, sadly, again, the C word is again strikes a chord of fear, not only in the general public, but also in the minds of doctors, because all of us are humans. And the reason is we know we can't stop it. Yes, we can do certain measures like hand hygiene, social distancing, which are the most key factors in containing this virus. So we can't stop it and can't treat it. At least we do not have level 1 evidence as to which drugs work most effectively against COVID or coronavirus. So I think that's what strikes a chord of fear. As doctors, I think we have a duty. The first duty is to our patients. And the second duty, I feel, is to us, that we have to keep ourselves safe so that we are able to look after our patients. Then I think comes the family, and then the colleagues and the hospitals or the trusts that we are working at, and the general society. So in these challenging times, I think for doctors, it's been quite tough, at least for me as a cancer specialist. There has been this moral dilemma that I've had, or ethical dilemma that I've had while treating cancer patients, is the risk of actual cancer that the patient has now, that has to be addressed now, versus the potential risk of COVID, which the patient is actually more likely to get because the immune system is compromised as a result of the cancer or as a result of the cancer treatment that they are getting. So I think to begin with, there was, in the first few weeks of lockdown, a lot of hospitals did this knee-jerk reaction where, OPDs were shut. But I think over time, now we are in the 7th week of lockdown, we have realized that cancer does not wait. And I think we should get on with the cancer treatment. A lot of us actually, right from day one, have tried to prioritize some cancer treatments over other cancer treatments, again, which is a huge dilemma that we have been faced with. I think the key challenges that as a doctor that I have faced is, and all of us are facing who are on the front line, are risk of getting the infection ourselves, the risk of infecting our patients as a result of that, or risk of infecting our loved ones when we come home. So there are a lot of precautions that go into when we are in hospital and when we are at home. And that is mainly because there is this thing about asymptomatic carriers. So you may not have any symptoms at all, and you may be infected with the virus, which you have the potential to pass on. So I think this is the main thing. But the good news is that majority of people who have been infected with corona, especially if there are certain risk factors, if you're not obese, if you do not have many comorbidities, in majority of patients, they have recovered just by quarantine and self-isolation. So I think now the guidelines are that even if you're positive and if you're asymptomatic, you just should self-quarantine and you don't need to be actually admitted. So I think the strategies, the next part I will talk about, the other challenges that I think around the country, I mean, personally, we have not faced this, but during these tough times, we hear about doctors or nurses not being allowed back into the societies if they come back after treating COVID patients, or, having FIR filed against them because somebody has got infected, and stories of violence, which actually all of us see. And I also have friends around the globe in US and UK, and you hear stories about colleagues who have succumbed to the illness. So yes, it does have, it does affect you mentally quite a lot. The ways to cope with it, I think what I have done, I'll just spend 2 minutes on it, is key thing is to stay fit, because I feel a happy doctor, it means a happy patient. So I think staying fit is very important. It's important that as doctors, we look after our health, exercise, yoga, meditation, whatever one likes, dancing. So I tend to do yoga and a bit of exercise. I try and spend about 25 minutes every day, trying and eating healthy. That's very, very important during these times. The other thing is I get a lot of satisfaction in helping and doing things for others. So there are certain things that I'm doing. I've written some articles to educate the general public about cancer and COVID times, about cancer and, let's say, oncofertility, doing these webinars with you, and also with other organizations, with Max as well. And also I've started a support group meeting for breast cancer patients every Monday at 6 p.m. Because I think communication and dialogue is very important for patients as well, and for clinicians as well, to cope with things. So staying positive in these times is very difficult, but I think one has to try our best to try and do that in whichever way we can, and take help if we need to. Like CanSupport has an amazing group of psychologist volunteers and healthcare workers who are trained in providing psychological support. So I feel as healthcare workers, whether you're a nurse or a doctor or anybody who's working in the front line, if you need to take help, I think we should not hesitate to do that. As doctors, I feel that I'm quite privileged that I am in the position, and all healthcare workers for that matter, that we are here, that we will be able to make a difference. And hopefully, we will talk about this in a few months' time in a different way. Thank you. Thank you.
Thank you, Dr. Bhavna, for sharing your experience. And I do understand that communication and dialogue really help.
Mm.
So I think everybody should communicate with each other, vent out, and this relaxes it. Thank you so much.
Absolutely. If people have questions, they can type it on the chat group and send it to you or to
Yeah.
everybody, or because asking would be difficult, or they can put up a hand. Actually, there's a feature which says you can put up your hand.
Actually, we have asked everybody to ask questions at last.
At
Let's
last.
finish all
Okay.
the sessions. They can all chat on the chat box, right there are questions, whatever they have. Thank you so much, Dr.
Thank you.
Bhavna. I will request Dr. Reena Sharma and Sister Savita Luka to take the next session. Dr. Reena is the head of palliative care field services at CanSupport. Over to Dr. Reena. Dr. Reena, can you put on your mic, please?
Sorry, I forgot to put on my mic.
Yeah.
Good afternoon, everyone. I'll be talking about the challenges faced by CanSupport's doctors and nurses during this COVID pandemic. This has been a very difficult time for all healthcare professionals, and we've all had to face multiple challenges. One of the main challenges that our teams faced was how to provide uh, care to our patients, good care to our patients during the lockdown, and especially because of the COVID pandemic. Another challenge was how to provide morphine to those patients who were on regular morphine and to provide it in a timely and adequate manner. For the safety of our staff as well as of the patients, most consultations were done on phone or through video consultations, but home visits were required. In fact, all people who do home care do require, especially if you do only home care, it's you have to visit your patients during in certain circumstances. Like we did decide on home visits, we made a criteria as to which patients should be visited. Like those patients who had very distressing symptoms like pain or any other symptoms which caused very severe distress, those patients who were in the terminal phase of their life and had refractory symptoms, those patients who were new and had multiple problems which we could not solve through video consultations or phone calls, those patients who needed morphine or other medical supplies. So all these patients needed to be visited. And because of the lockdown, many of our patients were not able to earn. So we also decided to provide ration. In fact, our volunteers helped us in this. They arranged ration for all the patients who were not able to earn any money during this period. And the teams went to the patients' homes to deliver this ration. Now, along with all these challenges, one of the main challenges when we first decided to home care was where to get vehicles, because no vehicles were trying. And we did try to do some home visits initially without any passes, curfew passes, but the police really troubled our drivers. So our admin team, within 7 to 10 days of the lockdown, got curfew passes for all our vehicles. And it was then possible for the teams to safely visit their patients and provide medical supplies or the care that was required. Another main challenge was, and it was a very big point of anxiety for all the doctors and nurses, was that because the patients were immunocompromised, it could be that we transmitted the infection to the patients, or that vice versa, that they got the infection. So we tried, it was essential that we arranged protective equipment for all our teams, and our resource mobilization team was very helpful in this. In a very timely manner, they were able to arrange appropriate PPE for all our teams. While visiting our teams, in addition to wearing PPE, we also asked caregivers and patients to wear masks if it was possible, especially as many of our patients live in slums and or they live in one-room dwellings where maintaining social distancing is often not possible. Another way of protecting patients and ensuring that they were not exposed to us was that when we had to deliver only medicines or morphine, we asked the caregivers to come to the vehicle to collect the morphine. While visiting sealed areas or hotspots, we at that time also we asked the caregivers to come to the barricade to collect the supplies. Sometimes our teams did cross barricades when, especially when morphine, nobody could come to collect the morphine, but that was, I think, on very rare occasions. In addition to this, our teams have had other challenges while dealing with their patients. Many patients have been stuck in villages or distant towns, and they've been been not no pain medication, so they've been in severe pain. And some of our teams have doctors and nurses have gone out of the way to ensure that these teams have been able to get their supply of medicine. One of our doctors called up an MLA in that particular district, and he got the medicines delivered to the patient. Some of our doctors have also and nurses have also tried to find chemists who will provide the medicines to the patients and try to ensure that if they could not pay for it, they would pay for the medicines. So our teams have worked in many different ways and had to find different solutions as to how to help patients in these times. And another way they helped was like some of our patients wanted to go home, especially those patients who are dying and they know that they would like to be with their family in the villages during this period, during this last time, and they would like to die at home. So some of our doctors and nurses have arranged ambulances so that the patients could be taken home and provided letters to them so that if they were stopped on the way, they would be allowed to go by the police. And in other ways, sometimes we've also provided information to cremation grounds when they want to know if the patient was a coronavirus patient or not, and they wouldn't cremate the body. So our teams have helped by providing a letter which is then sent to the caregivers on WhatsApp. So these are the different ways in which the teams have helped all the patients. Of course, the teams have, during all this, it's not, they have been very scared and they do have their fears that they'll carry home the disease to their families, and especially if they have young children or the patients are elderly. And they've also had the fear that, I mean, their families have had the fear that they would get the infection. And some of them did raise this thing that their families did not want them to work in this situation. But I think ultimately the fact that their patients depended on them, they showed their dedication, and all of them have been working to help the patients. In order to safeguard our staff, we have also not allowed our senior staff members to go to the field. And in fact, for some of them, this has been very frustrating because they would also like to go to the field and help as much as possible. I think through all this, we have all been there for each other, all our teams. We've shared whatever problems we've faced. We've shared our difficulties, the joy we've had when we've managed to succeed in helping a patient. And this has really helped us all, and it has motivated us all to do more and more. And in the background, uh, our support staff everybody, all the teams that CanSupport have been there with us. Our resource mobilization team, our admin team, Dr. Mohan with his supply of morphine he has ensured that we have not run out of morphine at all. Our volunteers who have always been, who have helped us by telling us whenever a patient is having a problem where we could help. So I think if one thing this coronavirus has taught us, and this lockdown, is that when we come together, we can help each other and we can find a solution to most problems. In fact, I'm sure the situation will keep changing, and new problems will keep coming up, new challenges will keep coming up. But I think if we keep working together, we will be able to solve most of the problems that are thrown to us. Thank you. Savita, would you like to add something?
Savita is our Deputy Head of Knowledge and Training at CanSupport, and she's a nurse. So I would like Savita to say a few words on the challenges of nurses.
Thank you, Jaspal. I think Dr. Reena has covered the most points, and I was continuing, having discussion with nurses, what all challenges they are facing and how they are coping up, and I was also trying to help. So thank you very much. She has covered all the points. So I shall now invite our next speaker, Ms. Jaspal Kaur, who is the senior chief counselor trainer in the training team of CanSupport, and she would be focusing on the challenges faced by counselors during pandemic time. So Jaspal, it's over to you now.
Thank you, Savita. Thank you, Dr. Reena, for such a wonderful session. And thank you so much, Dr. Reena, that CanSupport, even during this challenging time, kept going. And it's all because of the teamwork that CanSupport is doing. So I will talk about the challenges that counselors are facing during the corona lockdown time. You see, because of distancing, only two persons could share a car. Therefore, sometimes doctors and nurses were making the team, and sometimes nurses and counselors were making the team. And most of the counseling was done on telephone. Most of the counseling was done telephonically. You see, but wherever whenever there is the practical issues came, as Dr. Reena said, there were lots of practical issues, but I would like to divide them into two, like there were the practical issues as well as psychological issues. The practical issues were that even to reach the houses, in many areas, the gates were closed. So therefore, our car use has to be parked somewhere else, and either the patient families has to come out, or even going around, it used to take a lot of time reaching the home. And secondly, our cars were stopped for the passes, and that is the reason lots of time was also wasted. Thirdly, after reaching the patient's house, maintaining distance is also a big problem, because our patients are mostly very poor and they live in very, very small houses. So it was difficult to talk to caregivers, and we used to come out in the open to speak to caregivers. And to speak with the patient, we used to go inside. Lots of challenges were there. And especially the counseling challenges, because at this time, as you know, the anxiety and fear is there a lot. The fear of dying because of cancer is more. The COVID-19, few people did talk about that will be contact if you go to the hospitals, but because of the treatment not being done, the hospitals are closed. So they had many other psychological issues and fears. So main challenges in counseling came when patients were crying a lot, and becomes emotionally touching. And at that moment, it's difficult to even give a touch. But active listening played a very great role. Patients and caregivers have a lot of anxiety and fear. They ask, when will the treatment start? Will the treatment start? Will they die in pain? Here, the CanSupport counselors played a very good role. They used to say, we will not abandon you. We will keep coming. You're not alone. Your treatment will start once the hospitals open. We will keep giving you the informations, whatever we get, as soon as possible. And we will keep coming and provide pain medicines and other medicines. Symptoms will be controlled. So that used to give them lot of support, lot of support. And thanks to our counselors who were always on telephone and talking to them, taking their feedback, talking with the caregivers, despite their anger, fears, they were listening empathetically. Medicines and ration support helped them a lot. There was a lot of anticipatory grief of the caregivers, because this time the fear of dying at home, when few patients who were not even in their villages, they had come to Delhi to take treatment from different states. So there was a lot of grief that will they see their loved ones, and here the counselors played a great role. They used to make virtual calls. They used to tell them how to speak on video calling, They help them how to use it. So this helped them a lot. And sometimes even they used to call from their phone calls. So even few words like listening while long calls when they were crying and venting out, we used to say, "Thank you for sharing. Anything else you would like to share with us?" Make them feel comforted. We used to tell them, "Call anytime. Our telephone is available all the time." So bereavement counseling was also done on phone. Video calls also make a lot of difference. Seeing each other used to relax them. The bout of crying and talking helped. Hearing the comforting words, the simple sentences like फिर जल्दी आना, फिर आपसे कब बात होगी, आप कब आएंगे, आपसे बात करके बहुत अच्छा लगा. These comforting sentences used to make us want to do our work more and more. We also felt nice. Therefore, the takeaway message is virtual counseling is also very, very important. And it is needed at this time. And about how the counselors used to cope. They do a wonderful thing. Every evening, they used to meet on Zoom. So in the Zoom, they used to share their difficult cases, their case histories, and they used to say, "अरे क्या कर सकते हैं इसमें बताओ." So they used to get lots of feedback and appreciation also. And this way, the feedback and appreciation for their good work, they used to feel nice. This helped them cope with at the present situation. And some counselors, they have their own coping mechanisms. They like to sing, dance, listen to music. Yes, that is also helping them a lot. And sharing makes a lot of difference. Thank you so much. This is what I had for our CanSupport counselors. Now, I would like to invite Dr. Ravinder Mohan. Dr. Ravinder Mohan is the head of knowledge and training. He will talk about CanSupport's telephone helpline. Thank you.
Hello. Hello. Yes, sir. We can
Yes,
hear
sir, we
you.
can hear.
Please show my slides. Professor Chaturvedi is in.
Yes, yes, I am here, sir.
Thank you so much. Thank you so much.
Thanks. Welcome to this webinar. Since it is attended by most of the health professionals, and most of are busy talking in our respective specialties, so telephone helpline makes a sense. Our telephone helpline offers information regarding the COVID-19. People, your patients and your uh, uh, people in your community want to know about the symptoms, prevention, and of COVID-19. Our helpline is trained to answer such queries. The helpline is manned by 3 trained counselors. If they don't have query answer to the queries, the caller is connected to one of our senior doctors, and our helpline is confidential, and it gives information and emotional support to callers. And our counselors are trained regularly. They are trained before induction, and they undergo regular training throughout the year. Next slide, please. I want to draw your attention to helpline numbers. Our helpline works from 9:30 a.m. to 5:30 p.m. Monday to Friday. The call received after this time, after office time, are recorded and responded the next day. Telephone helpline facilitates networking with care providers. It overcomes barriers of physical distance. It offers, we don't offer financial support to people, but we help them to get finances. Cancer patients are helped to get finances through government schemes. And last, our social worker raised around 4 crores for cancer patients. We informed about cancer detection centers, various cancer hospital, and we make them refer them to shops where anti-cancer drugs are available at subsidized rates. And we often help them to get blood through blood banks, and also refer them to network with the people who provide processes. So helpline is very important during throughout the year, especially during the COVID epidemic. Please make use of this facility. This makes a difference. Thank you.
Thank you, Dr. Mohan, for the wonderful information about our helpline. Now I would like to invite Dr. Santosh Chaturvedi. Dr. Santosh Chaturvedi is a professor at NIMHANS, Bangalore. He will talk about bereavement issues at the time of COVID-19. Over to Dr. Chaturvedi. Thank you. Dr. Chaturvedi, can you on your mic, please? Thank you.
Okay. Yeah, thank you. Thank you. And good afternoon to all of you, and welcome to this very important session on COVID-related care and situations. So, as we've already heard about the type of difficulties which people are facing, I would like to talk a bit about bereavement issues in the current times. There are two types of bereavement issues which we need to be aware of. One is which is directly related to the COVID-19 infection, which is, people getting inflicted by it, and especially those who are more vulnerable, elderly, or those who have, additional medical disorders like diabetes, hypertension, any other chronic disease. So one is related to, of course, the COVID infection itself. And the second is related to the lockdown and the restrictions caused by the lockdown in dealing with this bereavement situation. So when we talk about bereavement, there are three aspects which we need to be conscious about. One is, there are three terms actually. One is bereavement. Bereavement basically means a loss of a person. It's also a loss of a loved one, loss of any object, loss of, now we are finding there are so many other things which people are losing besides death of a person. People are losing livelihood, people are losing their homes, people are, there is financial loss. So a whole lot of losses are there, which is also causing a complicated grief-like situation. So bereavement is the loss. Second is the grief. Grief is the grief reaction of a person. It is the psychological and emotional reaction that a person has. And in this context, I think we are all aware of the very famous stages which were described by Elizabeth Kubler-Ross of, the first stage being one of denial, second of anger, then bargaining, then depression, and lastly acceptance. So in the COVID situation, both with the infection as well as with the lockdown, a lot of it we are seeing is the stage of A, that is the anger. And the anger is there like it happens, that why me? Why does it happen to me? Why at this time? Why has the lockdown happened at this time? Why have we, to deal with so many challenges in our life? And these are everything which happened suddenly. So on one hand, it is unprecedented because most of us have not seen a similar situation in our life. Secondly, it has happened very, very acutely. It has happened suddenly. And, like for example, for the lockdown also, I think we were just given 4 hours or 6 hours time gap that from so-and-so time there will be a lockdown. So people did not know what to do. So followed by, a very brief stage of bargaining. When we talk about these stages, as I've just mentioned, these do not come in the same sequence. It doesn't always start with denial. It can start with anger. Like most of the reactions now are starting with anger. And then there is very little scope of bargaining. Then a lot of people go in depression. And I think the time is too short to even say that there has been acceptance. A normal grief lasts for anywhere between 6 months to 12 months. And we are still, just about 2 months since the whole situation has changed in our life. And like it has happened for the CanSupport, where people are finding it difficult to provide psychological, emotional, social support to the clients that you are serving. The same thing is happening to all other hospitals, including my hospital. Our hospital has closed down, and we are just providing emergency services. A lot of our service is also online. We are doing telecounseling, we are doing telephonic follow-ups, and in a way, we have learned some new lessons. But then this is not obviously the best type of situation. So these stages will happen. They will, from denial, anger, bargaining, depression, and again depression, then again anger, and trying to cope with it. And the second part of the lockdown is what is complicating grief. That is that because of social distancing, people are not allowed to participate in the grieving process, in the funerals, in the last rites. Unfortunately, I had a death of a very, very close family member of mine. And then, of course, it was in a different place. I could not go because there is no transport. I could not go by train or flight or anything that I would like to go. So when I contacted my cousins who were involved in that, who lost his mother, then we found that they were also not allowed to take people with them. So the funeral procession had only 6 or 8 people, and when they had to do the rites, no Purohit and Pandit was allowed to come there. And so this was at the peak of the lockdown period. Now things are a bit relaxed, but what I'm talking about is something which happened 3 weeks back, 4 weeks back. So imagine what happens to people who are doing the mourning process. So that is the third thing. We talked about bereavement is the loss, grief is the reaction. Third is the mourning. Mourning is very important because it helps the people overcome the grief. So if a person is not allowed mourning, it feels like a sense of incompleteness. I have not done what I should have done. I was not allowed to do whatever I should have done. So like they have the 9th day, 10th day, 11th day, 13th day ceremonies. They were not allowed to do. So my cousin is and their family are left with all types of doubts. What will happen to the soul of the mother? What will happen to the future of that? They are left with the feelings of guilt, but they are also helpless. They can't do anything because there is it was police which is enforcing it. It is just incidentally that it's the police which is enforcing. So if they do anything, even if it is for the benefit of public, if they do not follow it, it's considered as a crime. So they were totally helpless about what to do about various situations. So that is the another thing about lockdown. And I know we also saw that you would have all seen when we lost 2 very popular film stars, Irfan Khan and Rishi Kapoor. And the same thing was felt by Rishi Kapoor, because Rishi Kapoor's family, his daughter could not attend his funeral, and many people could not go. So what I'm saying is that a situation is there. Obviously, it was done for the protection and safety of a lot more people, so that the infection doesn't spread and everybody is safe. And it is for the good of people and public. But what happens to the family which gets affected? They are going to have very severe grief reaction, because that is one of the indicators. If you are not able to participate in a funeral, if you are not able to see the body of a person who has passed away, if you are not able to fulfill their last wishes, if you are not able to carry on the ceremonies, one is likely to have very severe grief reaction. And it will be there for a very long time. They will have all types of feelings of not only depression, but also of sin and guilt, that I wish I would have done something better. I wish I could have convinced the police or somebody, and things like those. So these are things which can happen. So the bereavement process for COVID related thing is different. It is similar to advanced cancer, but in a very fast forward manner, because usually the time is very short. I mean, we are very lucky in our country till date. The number of deaths has been less than 2,000. So we are. I mean, we are not seeing COVID-related deaths. 2,000 is in the whole country. So in some places it's much and more, and other places it is less. But we have not come across a lot of feelings like that. The same thing will happen. The other fears of not being able to go to a hospital or getting an infection from there or spreading to the infection, these health-related anxieties and fears and phobias are other things which are complicating the issues. So in this context, I heard one of the speaker mentioned about anticipatory grief. So anticipatory grief is starting in a lot of people. So when people are getting exposed to high risk areas where there can be infection or something like that, and or they start getting a cough or fever, then the first thing that they think of is whether they have got a COVID-19 infection. And those who have got infection, and we know that 80%, 85% are recovering, but people still go through this phase of anticipatory grief. What if it is that? Am I dying? Have I done all the things which I should have done? And the same stages of grief which come up. So I would like to probably wind up and stop now so that we can have some time for questions. Is that if the similar situation lasts, and we are also hearing other scientific news, I'm not talking about rumors, that there might be a second wave, there might be a third wave, people who have got positive and recovered, they can get an infection again. So all sorts of things. These are very early days of learning about the medical aspects of COVID-19. But such things can happen in future. So we should be prepared for it. One good thing which has happened with the lockdown is we have started interacting the way we are interacting now. So we should develop models of counseling over online, counseling over videos, counseling over telephone, providing grief counseling by this. This is very convenient, that I can sit in my office room and do this. Okay, but there is not a very good side, because there is another 3 hours webinar I have to attend just after this, which has been arranged by somebody else. So people find it very, convenient and easy method, but it takes a lot of strain. So we should develop, and I think CanSupport should also develop models, because even when the lockdown is totally over, this is a convenient method by which we can reach families' homes and provide counseling, provide advice, and wherever there is possible, provide grief therapy and support them with that. So thank you very much, and I'm here now if there are any questions for all the speakers or for me. Thank you.
Thank you, Dr. Santosh Chaturvedi, for enlightening us about the bereavement and grief, which we all, I think, apart a little bit, at least when we are hearing the newses and so many deaths and so many migrants, moving back to their villages, so many migrants dying because of the loss of job, ration. So I think it's a very, very challenging time, and this is the right time to talk about uh, the counseling issues, the grief issues. And thank you so much. Now we are open for the questions, and I would like not everybody to unmute their mics, but if anyone wants, let me see first the chat box, the questions. I don't see questions, it's just mostly all those who have joined. So anyone who has a question can please unmute their mic and question.
So, Jaspalji, I had a question from somebody. I think it just came to me. If I'm a carrier now, how will I know, since I will be asymptomatic? Should we get tested? So I think just to clarify that the ICMR has very strict criteria for testing, and that's Indian Council of Medical Research. So we have to follow those criteria. And right now they are not recommending asymptomatic people to be tested. I think the key thing is just follow the lockdown rules. That's the most important thing. Do hand washing and do the other things. Yeah.
So I think Dr. Reena can answer that. Can you please? person is in,
Dr. Bhavna has already answered, isn't it?
yeah, she has. And if anything else you want to add? Okay.
No, I
I think
think what Dr.
Reena,
Bhavna
what
said
Dr.
was absolutely right.
Yeah, and Dr. Reena, what you said was, that the guilt that we have as healthcare workers of not being able to give 100% to our patients. I have the
Yes.
same thing every single day. And the key thing is with the PPE, not being able to touch, hug, or, console the patient, which is so important. All of us are healthcare workers looking after cancer patients. So I had a patient just this week in the OPD, and talking about losing hair, losing the breast, mastectomy, and all of these at the same time. And she'd been through a lot of, all of us have some things that we've personally gone through in our lives. Is normally I would hug her, or hold her hand or something. It's very, very difficult, because you don't want to do that to protect her also. So I think we have a question here. Is this disease will retrieve it if he or she has been back from quarantine or been okay? Question to me. So can you get the disease again once you've come back from quarantine? I think if you, again, we are learning every day. This is a very flexible thing. There were some reports from South Korea that some people were reinfected, but I am not too sure about that. So once you develop the antibodies, I think now in India we are doing the IgG antibody. So if you have the IgG antibody, you are likely protected. But having a negative test, like I had a negative test recently, we all healthcare workers at Max were tested. I was negative, but that doesn't mean I'm negative forever. So ideally the test should be repeated every 5 days. And then there is the possibility within a test, because each test has its downsides as well. You may have a false negative also. So I think back from quarantine, yes, if you've developed antibodies, I would feel that you are protected and safe.
Thank you, Dr. Bhavna. Anyone else who want to ask a question?
Hello, can you hear me? I'm Harmala speaking here.
Yes, we
Hi,
can hear
Harmala.
you.
Yeah,
Yes.
I just wanted to ask you, Dr. Bhavna, that is it true that now any cancer patient entering the hospital has to take a test for COVID-19 that's compulsory?
So no, ICMR guidelines are very strict. And earlier, I think they had allowed that if a patient is getting admitted, let's say for cancer surgery as an inpatient, they could be COVID tested. But now the guidelines are very clear that before admission, we cannot ask for a COVID testing. So before patients come for chemotherapy to my daycare, I do not do a COVID test. It's important that we have to follow, for the greater good, we have to follow these guidelines, which keep changing every other day. But I think we have to look at the bigger picture about the number of kits available, number of kits that have to be prioritized at a certain place. So right now, no, we are not testing everybody who's getting admitted.
Well,
But
that's
yes,
good
if
to
they
know,
have
because
a high
then
risk,
added anxiety
I know it's, and
for
plus,
every cancer patient, isn't it?
absolutely. And plus, I think it's also for, so every patient potentially should be taken as COVID positive, and all the precautions are being followed. So the
Right.
doctors who operate are in full PPE, and all of those things are being done. There are some patients where we have, they've come from a red zone, there is history of exposure or in the area, then we can ask for a COVID test. But otherwise, we have to overall follow the ICMR guidelines.
Thank you.
Thank you so much, Umala. Thank you so much, Dr. Bhavna. I think Savita has a question.
Jaspal, I have a question for Professor Chaturvedi.
Please.
Can you hear me?
Yes, we can hear you.
Psychological effects of fear of getting infected.
Dr. Chaturvedi? Please
Yeah.
on your mic.
Yeah. See, the psychological effects of related to COVID infection, the main thing is the coronaphobia. See, the coronaphobia is what we are, most people are afraid of getting the infection. And Those who get, for them, the anxiety is whether they are going to fall in the 80-85% who do very well, or will they be in the 10% who will be moderately ill, or they will be in the 2 or 3%, when whom it is found to be fatal. It's also now, as Dr. Bhawna has just mentioned, the rules and regulations and the guidelines are changing every day. So earlier it was, let's say 3 weeks back or 4 weeks back, anybody who was positive was being admitted. But now it is that people need not be admitted. They should be isolated at home. Self-isolation should be there. Quarantine at home should be there. They need not go for quarantine in the hospital. So the fear of getting an infection is one. Tremendous anxiety is another one. But this is not the end, Dr. Mohan. This is going to be there for the next 6 months or 1 year, that people will think that whether we are going to get infection again, or whether we can get infection in future. Those who have had, as you know, just now Dr. Bhawna said, there are already reports that people who were positive and were treated became negative, then there have been reports of their developing positive. So, it is like, and it is unlike any other viral infection, that there will be other mutations of this, and, newer varieties might come. But so fear and anxiety is the most common reaction, and one should do anxiety control methods. Do not medicate, but use cognitive methods, mindfulness methods, or yoga to deal with the anxiety. And the best way to deal with anxiety is stay protected and save others. That's the most important thing. This is an infection which cannot come on its own. It is something which, if you have touched somewhere, or somebody has come very close to you without your using the, have touched or shaken hands or something, or touched the secretions of the person, the chances are very, very, very less. So the anxiety is going to be health-related anxiety, health-related phobia, and related symptoms to that. One would lose sleep. And like we just had one question before this, that should we test again and again, to see whether we are still negative or not. So these are the things which are going to be there.
Thank you, Dr.
Thank
Chaturvedi.
you.
Ma'am, I have a question for Dr. Chaturvedi here.
Yeah, please.
Yes.
Please.
Sir, now that someone in the government has also said that we have to learn to live with this COVID disease.
Yes.
The question is, sir, that in the long term, will depression increase in the general population? And if so, long-term pharmacological measures, and also will pain be aggravated in the patients that we see, cancer patients specifically that we see, who will have depressive features?
Yeah, the second question I can answer first. That is easy part. Yes, of course, pain will increase, because pain increases with anxiety, pain increases with depression, and pain increases with health worries. That is number one.
Yes.
Second is whether depression in the long run will increase or not. So it is just incidentally that I am the chairperson, I am the national chairperson of the task force set up by the Ministry of Health and Family Welfare for psychosocial issues related to COVID. And we have just finished our meeting yesterday evening, and we have made a plan how to deal with this over the next 6 months, 1 year, and the coming times. So it is quite likely that the depression is likely to increase, but that is not the only thing. See, we know of many psychological and symptoms like fatigue and other things which happen after a viral infection. So we still don't know. Like I said, this virus has been there only since December last year. And in our country, it has been there only for the last couple of months in a noticeable fashion. So what all will happen? Will people develop fatigue, tiredness, lassitude, cognitive disturbances, depression, which is because of that? But depression because of the effects of lockdown is definitely going to be there. And it will be there for a long time. It is because of the financial problems that people have had, a loss of job, and now they've started working from home. See, working from home is good in some ways, but it is not good in many other ways. Now, home has become school, home has become office, home has become gym, and in all this, we have lost home. There is no home. People used to say, I'm going home. Now you're not going anywhere, so you are there only. So it has a good side, and it also has a negative side. So I think one has to be very, very cautious about what complications are likely to happen.
Thank you, sir.
Thank you.
Thank you. Thank you. There's another question from Savita Luka. During this pandemic time, are home care team nurses doing dressing of wounds and other procedure at home? How would they do the waste management? From Dr. Bhavna.
So I think we should follow the best practices for handling infectious waste, because you have no idea whether the patient may have had an infection or not. So again, you seal it in a closed disposal bag and dispose of the waste as you would do any infected waste. Very important that we do it properly.
Thank you so much, Bhavna. And there's another question from Dr. Chaturvedi. The question is that one of my patient's family has done their last rites of the member expired over phone. They are very much in grief. How to encourage them or to help to cope with the situation, as Pandit was only available over phone and Skype?
Yeah, this is just a situation which I also faced, and I mean, in a way, we are thankful that a Pandit was available on phone or on a video. It could happen. Yeah, but like I said, the grief is going to be very severe in such people, and we should wait for this acute time to get over, and and then provide grief therapy. Hopefully, once the lockdown is more and more relaxed, therapy can be given in person. But till that time, ventilation or support can be provided over phone, and that is what people are missing. One is saying that okay, there is a lot of social interaction, but social interaction on WhatsApp and on email is not the same as an interaction in person. But in between, this video thing is little better, and so that type of support should be provided.
And it really gives them a lot of support that at least we can see the last rites of the loved one.
Yes.
Yeah.
And Dr. Ravinder Mohan has asked about the impact on mental health. Of course, there is going to be a lot of impact on mental health in times to come. One should not only keep and live safe, but should also look after your mental health.
Anyone else want to ask? There are only, I think, 2 minutes left. One question can be taken.
If not, can I make one comment?
Please do that, Dr.
Yes.
Chaturvedi.
No. I think Dr. Bhavna had mentioned this about the dilemmas that we are going through. So there is something called as moral injury. We have when we are not sure what to do, when we know if a person is infected, or are we putting ourselves at more risk? Should we do this for one patient and not for other patient? These are all ethical and moral dilemmas which are going to happen in dealing with this situation. And there is no immediate cure for this. I don't have an answer for this, but I know this is a phenomena which we are all likely to face.
And the other thing, Dr. Chaturvedi, is, like in Tata Hospital, I was reading this article which came out where they've said we prioritized certain patients, like curative patients over palliative patients. Yes. I think all of this is very, very, very difficult for me because, as you always try and personalize it. So
yes.
I think it's going to be more hard for the cancer specialists in the future.
Yeah, I really don't know why they said that, because it has a good palliative care unit. Palliative care does not cost so much as compared to the other curative therapies, and it can be done at home. So I don't know, putting it low in the priority, and it is something which was published in an international journal. I was personally very disappointed to read that, because I'm quite sure the care can be provided without much difficulty.
Absolutely, yeah.
It goes hand in hand. The curative, palliative part, they go hand in hand.
Absolutely.
Thank you so much. And I think I would express my deep gratitude to all the speakers for such an inspiring and informative talk. I extend my thanks to the audience for being patient and being active participants in this webinar. More to go. Thank you so much, everyone.
Thank you. Thank you.
Thank you.
Thank you.
Thank you. Thank
Thank you.
Thank you. Thank you so much to all.
Thank
you so
you.
much.
Thank you. Most welcome.
Thank you. Thank you, everyone.